Hi, everyone. Welcome to the next show. Polypharmacy is wreaking absolute havoc on many nations, including the United States and United Kingdom. And what this means is a large number of prescriptions. The statistics are absolutely staggering. And we're fast at the point, we're probably already here, where the disadvantages of being on so many medications sadly outweigh the benefits. So we're going to have a discussion about this and how anybody out there can hopefully wean themselves or a family member off medications with their doctor as well, if they're not necessary. And for those of you who enjoy our discussions, please do check in the links down below, our separate unique channel where we have a lot of discussions about issues pertinent to your health. So let's talk first about one of the most common classes of medications which are overprescribed, particularly in over 60s, and that is antidepressants.
So, I love when my patients come to me and say they want to start getting off a certain type of medication. Antidepressants are one of the many that we look at to see if we can get patients off of. There are many different classes of antidepressants, and you have to be very careful weaning off these. Many of these as anyone that's on an antidepressant, you slowly have to build up, especially the medications called SSRIs. You have to slowly build up after a few months. And if you're going to wean off, you have to do the same thing. You have to wean down over weeks to, potentially a little bit longer. But SSRIs and other antidepressants have a lot of side effects. They can cause a lot of problems. So weaning off is definitely a noble goal if you're able to do so. What I recommend is coming to your doctor and asking them, is this something we can start doing? A big one that you might hear a lot about is Lexapro. You'll also hear of Zoloft, Prozac, medications like that. The way I typically do it is start you at the dose you're on and start going down, cutting you in half, cutting you less than that, depending on how long you've been on, and then starting to wean you off. I think it's a very noble goal. We do it all the time, and it usually goes quite well.
I do agree, Ben. The side effects I see mostly with antidepressants is really a lot of people with weight gain. And I think it's the serotonin that is boosted in your brain by the mechanisms of the medication that increases appetite, changes metabolism. And I often see patients that come to me that have weight gain. They can't really explain it. I look at their medication list, and that's always like a big red flag.
Oh, it's absolutely awful. And a frequent scenario for me is I will see older people in the hospital in their 60s, 70s, 80s. And they've been on these antidepressants for years that they got put on them. And often they'll say to me, well, I'm not sure I need it anymore. And I'll say, well, did a discussion ever happen with your doctor? Because of course, these discussions should always happen with a doctor because as Ben said, the strategy should be to gradually wean down. Nothing should be abruptly stopped over time. But what do you think, Ben, as you see in primary care, would be some common other side effects apart from weight gain of people who are on antidepressants, whether they're SSRIs or any other type for a while?
So I've seen them have paradoxical effects. So at times they can actually increase anxiety and depression at times if used incorrectly or if they're interacting with other medications. Certain types of medications, if given together with specifically the SSRIs or the serotonin medications, they can cause a very dangerous syndrome called serotonin syndrome. Which is really quite dangerous. Sometimes we see things like that. It can affect multiple organ systems you have to watch out for. The other thing I wanted to say is you always have to wonder, why was somebody put on one of these medications? And if you go back, a lot of time you'll find it was for a very specific life event. Something happened to that person that was a specific event and they were put on the medication. It was never reevaluated, like you said. So if you were put on to get over a certain thing that happened in your life, it is always worth reevaluating if maybe you don't need it anymore. Because again, these medications, they all have side effects and they all interact with other medications. So you have to be really careful.
That's such an important point, Ben. I mean, I see that all the time. And especially with this medication too, if you think about it, it's probably one of the more important medications we'll probably talk about. It's a mind-altering medication that someone might have been put on it 10 years ago for a significant life event, as you said, and it's a typical start a medication, everyone's going to turn it to your other doctor to think that, well, this person will stop it and this person will stop it. That goes to the underlying point we're trying to get across, that sometimes no one will stop it unless unless you're your own advocate.
Yeah, well said. And the statistics are staggering. I mean, I saw a statistic, we're talking generally about prescription medications. Almost 90% of everybody over 60 years old is on at least one prescription. So if you're not, fantastic, you're in the minority. And 40 to 50% on 5 or more pills. And a lot of the times, yeah, it's antidepressants. So bottom line is, if your mood is stable, everything else is going well, and you've just been on an antidepressant for a long time, and you think you can come off it, you probably can, but speak with your doctor and coordinate a strategy to get off it. So let's talk next about another huge class of medications that we talked about before, the anti-cholesterol medications, and how anybody who is concerned about this could potentially wean off, and how the cardiologist here might have a thing or two to say about that. We're all minimalist doctors, by the way. Get our meds if you can.
Yeah, I mean, this really hits home in my specialty, because this is something I see all the time, and there is a push for people to be on cholesterol medications. As a specialist too, that I think, doctors send patients to just expecting that you will put them on a cholesterol medication, and if not, you're kind of not doing your job. But I can't tell you how many times I've seen people on a cholesterol medication, and honestly, they don't even know what their cholesterol was. They were just told to be put on, they need to be on this medication. They didn't question it. And a lot of times it really was and has been overused. And I think there's lots of different ways of going about this, but, definitely speaking to your doctor. I think the side effects that we've gone through so much about statins that, people know about are muscle aches, myalgias, links to maybe cognitive impairment later in life, maybe some links to diabetes, but it's really a medication that is so often overprescribed. Really, most of the time people start it, they're not really given the chance of lifestyle changes first, right? I mean, that's so important. And I know that you guys advocate that as well, but a lot of times I will talk to patients and they've never had a chance to exercise, eat healthier. A lot of the times the statins, for specific things are indicated. If you had a stroke or a heart attack, I don't disagree with statin use in that. But if you're borderline cholesterol and you are overweight and underactive, why not do those first to get off the medication?
Really good point. And would you advise, if anybody's on a cholesterol pill and wants to come off it, obviously you have to go over this with your doctor and numbers and individual risk, but would that also be weaning like antidepressants, or can they be stopped by a doctor?
Statins don't necessarily have an addictive component to it, or like a really weaning trial. I think a lot of times I'd stop it, especially if people are experiencing side effects. I'd stop it that day. I don't say that you have to weigh down. I think that the half-life, or it gets out of your body, pretty quickly.
I do like that about statins, that you can stop them pretty easily, as opposed to many of the antidepressants that you have to slowly wean down and be really careful. Yeah. And the good thing about, cholesterol management is it's something you do slowly over time, right? So it's not a big deal if you were to lower it, stop it right away and just kind of keep tabs on things.
It really should be like a collaboration between you and your doctor. And I think that just coming to see me, and it can be really algorithmic, that you come to see a cardiologist and you leave on a statin.
Yeah.
That's not how I practice, but you can really, and people are put on statins just like other medications, and no one stops them.
It's so sad. And that's why you're a good doctor. I mean, we want to get people on as few medications as possible and recognize that side effects are there. And it shouldn't be a pill for life, a life sentence once you're prescribed. Let's move on to blood pressure pills, our other big medication. Every year, the guidelines seem to get stricter and stricter, and gosh, where to get started on how many people are over-medicated for blood pressure. What would be a good strategy? And I'll come to you first, Ben, in primary care. If somebody's measuring their blood pressure, say at home, and blood pressure is good, and they think they might be over-treated because they're having dizzy spells or the blood pressure is kind of dipping, what would you typically do? Would you wean down one gradually or cut one? Well, what's the way you think?
Absolutely. That's a great question. So it depends on which medications you're on and how much. So if you are on a very small amount of a medication, so that's what you have to find out first, working with your doctor and doing your own research. So if you're on a very small amount of blood pressure medication and you are getting, these dizzy spells, or your blood pressure's very well controlled or even low, if you're on a low dose, you might be able to just stop it. And you could talk to your doctor about, hey, can I just stop this medication? Keep checking my blood pressure at home. And, buying a blood pressure cuff is always so helpful to get a lot of data to figure this out. If you're on a few blood pressure medications in high doses, yeah, usually what I do is pick one, cut it in half, and then see how the person does, and then maybe get rid of that one. I always like to eliminate one fully before working on the others, because the goal is to get you off, right? So as many as you can get off is the key. That's usually how I approach it. But you have to be careful and you have to know what the medication is. For example, there's one called clonidine that you guys are catapris. That one can have rebound hypertension. What that means is if you don't take it, you can get this, you can shoot up. So you have to be very careful getting off that one and work with your doctor on that one. So that's just an example where, where to be careful and you have to know what you're doing.
Okay, everyone, I'm going to interrupt that tremendous discussion for a moment to tell you about our expanding health and well-being store. I'm very proud of our natural, uniquely formulated products. Check in the links down below. We've got our natural anti-inflammation immune support, bone support, memory support, heart support, and sleep support. Also, our newly released organic chai mix based on the tea that I regularly drink. We are made in the USA and very proud to be working with a veteran-owned company. ohighwellness.com if you're in the USA, North America. ohighwellness.co if you're in the UK, Europe. All right, back to the discussion. That's clonidine. It's quite a rare blood pressure pill, usually third or fourth line. Would you say that there's a blood pressure pill? So let's take a hypothetical scenario because this happens so often. Somebody's on 3 or 4 medications and you suspect that they're way over-treated, which commonly happens. Is there a certain medication that you think I'm going to stop that category first before others?
That's so true. And I see patients that tend to come in that scenario where they are on multiple medications. I rarely maybe don't see patients on one medication. They usually have resistant high blood pressure. So really that's like 3 or more blood pressure medications. I've said this in the past. I don't love beta blockers for the first line treatment. They are in the quote unquote guidelines. I just think that the side effect profile of them are pretty stunning. I've really not met many people who are on a beta blocker like metoprolol, atenolol, carvedilol that come in and say, I feel great. A lot of time they feel fatigued, foggy headed, and lots of different scenarios can come from this medication. And they're taking them in the morning. And that's a double whammy for me is that this is the daytime fatigue on that medication. So that's usually when I stop first, which, my approach to blood pressure is this, is I see a patient, I want to know when your blood pressure started because I have patients that have been on blood pressure medications for 30 years and no one's really looked into seeing why they have high blood pressure. And that's really important. And I think that goes to a lot of disease states that we see is that we're just assuming that you have high blood pressure because the last doctor you said did. And I think you can't really trust anyone. You have to really go through, the details and the past history of the patient. And so for me, young people, big red flag, if they've had high blood pressure without a kind of secondary workup, meaning is there anything else going on in the body that could be driving up the blood pressure? As you get older, arteries stiffen. So those people, it's just really probably age-related changes. And that's why we see high blood pressure that arises as we all get older. I do think, though, that that's something to definitely talk to your doctor about. And that's really important because I have one patient, again, who blood pressure medications for 30 years, 3 or 4 medications, ended up having a tumor on her adrenal gland that was discovered with blood work for secondary working about blood pressure, had that removed, no blood pressure medications. And this is someone that was on blood pressure medications for her late 20s into almost her 60s.
And those doctors source, let's investigate well.
And so there's other things that, can be done.
There's always, like that would be, that's rare, but of course these things stick in our minds. That's quite a story.
But that's polypharmacy in blood pressure medications is a really big deal because everyone really just throws medications at, and you're on one blood pressure medication, it's not working. So let's just put you on this one, but you don't know if it's going to stick or not. I tried to tailor it better for my patients where I will get them have like an echocardiogram, an ultrasound of the heart, which looks at the rooms and the chambers and the valves of the heart. Is there any strain on the heart from high blood pressure? There's certain medications that can be tailored for the patient specifically, depending on it. I look into family members who've been on blood pressure medications. Have they responded well to those? I mean, there's probably some genetic predisposition, but the polypharmacy in blood pressure medication is actually incredible.
It is. I believe the cost lies. I really do, because how many times in the hospital do we see somebody come in who's on blood pressure meds? It's clear that their blood pressure has been overtreated for some time. They've fallen, they got dizzy, or they got sick with something else, and everything has kind of been exacerbated. This is why blood pressure needs very, very close surveillance. Okay, let's move on next to pain medicines. This is a tough one because, of course, as doctors, the very last thing we want is for people to be in pain. But pain is often overtreated as well. And this is something that we see a lot. Pain medicine, of course, the medicine numbs out receptors, but it also makes people drowsy. So it's very important, particularly if we're talking neuropathic nerve pain, to strike a balance. If you, or this might be more common, you think a loved one is being overtreated for pain, and it's very tough, but what would be some strategies to try to get off something and improve somebody's mental status?
Absolutely. So it depends on what kind of pain you're talking about and where. So, you had brought this up already, neuropathic pain. That is one of the biggest ones. And what we're talking about is kind of a nerve inflammation. They're usually coming, a nerve that's pinched coming out of the back or the neck. That is a very hard area to get to and can cause very intense pain. The medications you're going to see prescribed a lot are gabapentin and Lyrica. These are both the nerve medications. I'll be perfectly honest, anyone that's on them right now, they probably experience this. They just don't work that well. They really often do not kind of handle the pain the way it should be handled. What you'll see is you'll keep coming to the doctor with the same complaint that the pain is killing me, my sciatica is killing me, and they keep going up on the medication, or they put you on a different pain medication, such as an opioid or something like that. It's really not the best strategy for the nerve pain. Really what you need to do, there's a lot of, the first thing you have to do, and if you haven't done it, it's the most important, is the physical work. So the physical exercises, the stretching, the attempting to deal with the pain in that way first. That's an absolutely huge one. There's some more natural remedies that we sometimes look at to treat this kind of pain. There are certain kinds of supplements and things like that, and that are a little bit more helpful. And again, physical exercises and stretching. But going straight to the pain medications right away, it really sends you down this track where it's very hard to get off of them.
And weaning down, if somebody needs to be weaned down, gabapentin, we talked about before, it's one of our least favorite medicines, but assuming that would be a gradual taper, don't abruptly stop any medicine for pain.
That you would want to go slowly. Actually, probably most of the pain medications we would talk about, you do want to taper down slowly. It's pretty rare that you'd have a pain medication that you just stop like that. Many of them can cause withdrawal. Other ones can cause other problems if you go too quickly. So yeah, that's definitely something I'd talk to your doctor about. But it's worth doing. They also make you drowsy. If you get up in the middle of the night and you're on gabapentin or a med, your risk of having a fall is much, much higher. Your risk of confusion, it can increase your risk of dementia. So, these are the kind of things you definitely want to be trying to get off if you can.
You're really just masking the pains. That's not really treating it. And I think that's really the problem here too, is that some people do need it, but going back to finding the root cause, like what is causing the pain, because again, you're going to go see another doctor who just assumes you have chronic pain and is not going to try to look into or delve into your past to see why you're having that pain. So
yeah, it's a very difficult topic. I do accept that, because I see the end of the spectrum that comes into hospital with issues, but yet nobody wants to be in pain. And the truth is that these pain medicines, yes, they work because they knock out the receptors in your brain, but they also make you very drowsy as well. So there's a ton of potential side effects, and over-treatment of pain, which statistically, what percentage of all narcotics in the world are prescribed in the United States? It's a shockingly high percentage. I think I saw over 50% from only 5% of the world's population. So it's clear that we're a country that is in so much pain that it needs more medications than any other nation, or there's a prescription issue, which I believe. Now, I had never heard of hydromorphone, which is Dilaudid. before I moved to the United States. They don't use it routinely in other countries. They use morphine, but that, I believe, is only one step below heroin. And it is dished out fairly regularly in hospitals. It's extremely powerful, and hydromorphone. So I think culturally there's a problem here with over-prescribing for pain. Do you have any other thoughts on that?
No, I mean, I was going to say, going back to Dilaudid, it's 10 times more powerful than morphine, and it's given out a lot to patients. And I think really it's going back to the root cause.
Yeah, fixing that. Okay, let's talk about our next category of medications, which are very likely overprescribed and people might be able to come off. And those are anti-dementia medications, which have very iffy research behind them. But how could anybody come off their dementia medicines if they and their family would want them off them?
Well, that's usually easier to do. So the problem with the dementia medications that we currently have, there aren't very many of them. And I think as many of you know that have a loved one that have suffered with dementia, there's very little doctors will be able to offer you, which is extremely unfortunate. But the medications they'll offer you, I think a lot of the time you'll see they don't have the intended effect. The person still progresses with the disease. The big ones are one called Aricept with an A, and the other one is Namenda. Memantidine is its other name. Those actually you can really just usually stop, but that's not, you can talk to your doctor and say, hey, this really isn't working. Are you okay if we stop these medications? They come with side effects and the benefits are very minimal. Now, the problem most people had is they're very worried that if I stop this, am I not doing anything for this loved one that has the disease? That's a discussion you can have with your doctor. But again, we always encourage that you do your own homework, that you read about these medications. I think you'll find they're just not very effective. So as much as we all want to do something for people that are suffering from this, make sure that going on a medication like this is the right thing to do.
I agree. I think the research, if you look at supplements like ginkgo and ashwagandha, actually there's much more compelling research, in my opinion, behind it. Again, there's no real cure, but I'm really not impressed with the dementia medicines that the medical establishment pushes.
I think there's a huge role in naturopathic medicine in dementia. That's how I've always felt. I think that there's probably a lot more experience in treating it than the medications that you don't know about, Ben.
Yeah. How do you feel, this is a different topic, about the more powerful antipsychotic medications? So these are medicines, supposing somebody who has dementia, it's really sad, we deal with it in the hospital, who's very agitated and sort of behaving in a way where they're a risk to others and themselves. Do you think we overtreat with those medicines, or do you think...
Oh, absolutely. Absolutely. I think that's a very hard question, because if you've ever suffered with a family member who's going through that, it's incredibly hard. I mean, you're trying to keep this person safe. You're trying to keep other people safe. When you're in the hospital, you'll see that the best thing a lot of the time is a familiar environment for these people when they go to the hospital, and sometimes they have to. That's always when this stuff gets worse. Having a good routine, where they do the same thing most days and both nights, typically you're able to keep this more or less at bay. The medicines really, the antipsychotics, the ones that are used, it's sometimes they'll take the edge off a bit, but they often don't do the job we're hoping they're going to do. So no, I agree. I think a lot of time it's overtreated. It's especially overtreated if there's not a family member kind of speaking up and saying, hey, I can help out. I can take care of them. I can work with them. Sometimes if people are just trying to get someone to be quiet because they're agitated, they will get all kinds of medicine that they probably shouldn't be getting.
Mind-numbing medications.
Yeah, mind-altering medicines. It's sad, and we have a huge issue. So let's talk about what else we can do, because I will be quite frank and honest, as I suppose many of you who watch expect me to be, and maybe my two colleagues here might think that I'm being extreme when I say that I think the medical profession is completely lost and utterly useless in this regard. There are very few doctors out there who have a mentality of let's de-escalate the medicines. And I absolutely relish doing this. And I will see somebody in the hospital. Frequently, it's sad. It's somebody from a nursing home or very elderly on 20, 25 pills. And their families will be so happy to get them off medications. Even younger people who are living at home, I'll say, look, this is your medication list. I don't think this is necessary. We could do this now. Follow up with your other doctor as an outpatient. I will say that I personally believe that with the current state of medicine, that pharmacists are probably better at this than doctors right now. So that might be a good port of call for you in your area. Do you gentlemen have any other thoughts on that? Pharmacists?
No, I don't feel pharmacists as a key point in contacting. I always recommend my patients to talk to their pharmacist about drug interactions, about cost. I mean, they're huge, like a wealth of information. And I really do believe that speaking with a pharmacist, especially a good one, can really cut down your amount of medications. And in some cases, it's been shown up to about 40% of medications, can be cut down that were inappropriate.
I think over 50% are.
I think necessary in many people. I think pharmacists are widely underutilized within the system. I know what we think of is that pharmacists do now is you go to the pharmacy and pick up your medications and they tell you a couple of things and you're gone. I mean, I think pharmacists should in our system have a much bigger role, kind of controlling medications and making sure that they're the ones that, kind of know all the, I mean, doctors know it too, but pharmacists definitely know all the side effects, all the interactions. These meds really shouldn't go. They're the ones that'll often call you and say, hey, these two medications have massive side effects together. You sure you want this patient on both of these? They're I think, wildly underutilized. I think they need to have a much bigger role and widely overworked as well.
Oh, because everyone overprescribes.
Yeah.
The pharmacist is such an excellent resource of information, but unfortunately, they're all overworked because everyone has been overprescribing, and the amount of work they have to do is unfortunate, and their real value or their real knowledge isn't being utilized, and it's really being underutilized by the pharmacists.
Absolutely. It is. Pharmacists out there, or if you know a pharmacist, we appreciate you. You do some great work. And I think holistic pharmacy would be a great specialty for the future and do very well indeed. Okay, we will wrap up. We have gone over a few categories of medications there, and we could talk about more, I'm sure, but we wanted to give you a gist of the problem, and I will end with what I started with. This is a terrible problem. Polypharmacy, we're now at the stage where we're probably causing more problems with medications than we're actually solving. And the medical profession really needs to get its act together. If you suspect that you or a loved one is over-medicated, if your gut is telling you that, you're probably right. I know it's tough. Hopefully you can find a good doctor in your area who can sit down with you. If you can't, please find a pharmacist because this is too important. You cannot allow over-medication and polypharmacy to ruin a life.
So true. And no one should ever think that the medication prescribing or being on medication is a natural process of aging. It's really unnatural. You have to be an advocate to get off medications.
Well said.
And I don't think every medication that you've been prescribed necessarily has to be for life. I think every time you see your doctor, your goal should be, hey, among other things, can I come off of some of these? That's a question I would be asking during every visit. And by the way, are some of these things I'm feeling, some of these complaints I have, could they be side effects of my medication? Those are always questions that are worth asking.
Yeah, that's right. Your problem could well be a side effect. That is not an uncommon scenario. All right, everybody. Thank you for watching. We are rooting for you all to succeed. Keep going, everyone. Stay strong. And do check in the links down below if you enjoy these discussions, our own separate channel where we post some other exclusive content, and also our natural health and well-being store, ohighwellness.com. If you're in the USA, North America, ohighwellness.co. If you're in the UK, Europe, we are very excited about our expanding store. If you enjoyed this discussion, you will also enjoy some of our other discussions about optimizing metabolic health. We've had lots of other discussions posted on this channel and our other channel. Do hit the like button if you like this video, the subscribe button for more similar videos in the future. And we are going to speak to you again very soon.